everyone. Bueller, occupational therapist, and we have
Mike, I'm the physical therapist.
Yeah, today we decided to do it a little different. I thought I'd give you an opportunity to say who you are. So today we come back with some exercises. Actually, it's just one exercise that we're doing, right? And it's mainly for strengthening the lower body, right? And it's going to
work on your quadriceps, your glutes. These are the muscles that are super important for getting you to stand up out of a chair safely. A lot of falls happen when people are trying to get up out of a chair and they can't do it. So.
Yeah, and that's what I wanted to say. You know, a lot of times people fall when they're trying to get up out of a chair, especially if it's a lower chair too sometimes, you know, depending on the variation of heights. And people, you know, when they go out or go to different places, you may have different heights of chairs and things like that. And we think like during this time with a lot of the social distancing, people staying at home, this is one quick exercise that people can do that is effective and efficient, and you can actually progress it based on where the person's at, right?
And it is a quick test to see if you're having balance problems and you're at risk of falling, because if you can't get out of a chair, a normal sized chair like this, without using your arms to push yourself up, that right there is a sure sign that you're at an increased risk of falling when you're doing things. So.
Yeah, so I think that, you know, just demonstrating that exercise is a good one, you know, to move forward, you know, before you start any other exercises. But also, just as a quick disclaimer, we got to make sure that, you know, before you start any exercise program, to check with your physician or check if there's someone's having physical therapy, to check with the therapist if that's a safe exercise to do. So these are just informational videos, and make sure that you check with your physician and your therapist prior to initiating that. So we have two chairs here, actually. Michael, I'm going to sit down. You're going to demonstrate with me, okay?
This chair is the one she's going to be sitting in. This chair is put in front of her just for safety issues, especially if you're having balance problems, because we're going to ask you to lean forward when you stand up. And if you feel worried that you may fall forward, which is very, 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 very rare, then you'll have a chair there to stop you from doing it. So first thing, she's sitting back in the chair. Okay, to get ready to do this exercise, you want to slide forward in the chair.
So we get to that dynamic position, you know, because trying to get up from here is really tough to do. So you want to make sure you get into that dynamic position right there.
Okay, and then you're going to cross your arms, cross your chest. Okay, and when you go to stand up, the proper way is to get your head forward. As we like to say in physical therapy, you put your nose over your toes. Okay, and then you go up and down. Okay. The goal of this exercise is to be able to do 2 sets of 10 without the use of your arms. Okay, but a lot of people can't do that. So if you're too weak to get up without using your arms, start off the exercise still moving forward in the chair. You always want to do that as a safety measure, and it gets you in the right position.
And then what we could also do is add, like, if you have a cushion, you could also put a cushion in the chair. And then some people have maybe those recliners that elevate, which we don't typically like, but they could either adjust that height appropriately to where they could
yeah, you can make the seat higher so that you can do it without holding onto the arms. But like she said, you can use a pillow, you can use a lift chair. If your bed's a little bit higher than your normal chair and you can do it with that, that'll be perfect too.
Bed like there, so.
Yep. So, okay, so she's just gonna use her hands now. Still want to get your head forward, your nose over your toes, like I said, and go up and down. Okay.
And then come slowly down. You know, the tendency that we sometimes see with some people is, whoops, the flop.
The flop
the
into the
famous
chair.
flop.
Yep.
So to make sure that it's a slow and steady decline. Okay.
So then once you get to where you're able to do that, well, if you're using a cushion, you want to get to where you're doing 2 sets of 10 with the cushion. If once you get to that point, you want to reduce the cushion so that you're lower down and start, using your hands without the cushion. And once you get where you can do 2 sets of 10 with using both hands, you can reduce it down to using one hand.
So we just, for demonstration purposes, we scoot forward, your nose over your toes, and up with the one hand, and back down. But then also they can, if someone can't do 10, you kind of want them to try to start doing like maybe...
Cut it in half to 5.
5 or less than that.
If that's still difficult, if you can do 2 sets of 2, that would be fine too. And just try to add 1 every few days, make it 2 sets of 3, 2 sets of 4, and work yourself up to the goal of 2 sets of 10 when you're doing it. So, so that's about...
I think the other thing that you can do is take a chair and, sorry, showing my back, but push it up against something that's sturdy, so you can, that can also be, an extra support there. So you could put it up against a wall.
That way the chair doesn't slide away from you. Especially if you're going to use your dining room, your kitchen nook chairs that have wheels on them. That needs to be against something, but I highly recommend against using a chair that has wheels on it because it's going to be highly unsafe.
Yeah, I would go with no wheels at all. I would just say just have a sturdy chair and go with the sturdy chair and not use any wheels at all, because that can be quite a dangerous situation depending on if those wheels slide sideways as well. So,
but things you can use to block it are a desk. The kitchen counter is a great sturdy surface to use. So you can use a wall. Not many people have an open space on the wall, but a wall works too. So.
Yeah, and with the bed, you could, the bed's higher, and that's a nice surface to start off with if you don't have a lift chair or cushions to put in. You also can put the chair in front of you and just go ahead and come up to stand. And that, that's a quick, simple exercise, but it's effective, a way to, prevent the falls and strengthen your lower extremities.
And I would recommend you do it at least once a day, twice a day. Doing 2 sets of these exercises will definitely help you a lot quicker.
Sounds good. I think that covers everything there, Michael. So we'll be back next week with another video, informational video. And like us on Facebook, subscribe to us on our YouTube channel as well, and give us feedback and good comments. We'd appreciate that, so that we can get those views and likes up there. Thank you for listening, and until next week.
Yep. If you have any questions, feel free to give us a call and ask for Mike or Beulah, and we'll answer any questions about physical therapy and exercise programs. All right.